Hello, students. We are going to talk about adaptation around groups of people who share similar types of issues and concerns. And this is sometimes called special populations. You might notice that on the MBLEX exam. Uh, it is our chapter 14 on adaptive massage. So here we go. Our wonderful cover image, and down we go to chapter 14. We only really got two more to go after this. Wow, we are getting there. Okay, so what is this chapter about, and how are you going to study it? So this information, most of it is possibly going to be found on the MBLEX on how you would generally adapt to clients that might present with these types of issues or circumstances. This is a critical thinking chapter, and the chapter content tries to give you some parameters around where the thinking process would occur and further investigation. And each one of these areas could actually become a specialization. It's not that there are specific massage methods. Everything that's been covered in the textbook thus far is appropriate. The advanced understanding or the specialization understanding comes in additional information about the population, not what to do when you're giving them a massage. Everything that you've got so far will give you the skill set that you need. The adaptation comes from how you pick and choose and how you modify it. So here are our populations, and adapting massage to animals, I think, is very important. Um, Pets, companion animals, and working animals have are a very important source of comfort and support. And so I think it's important for us to have an awareness of how we would adapt massage in this direction, and more so teaching clients how to work with their pets. Very similar to working with children. Athletes, we already talked about this a little bit in the career pathways chapter, but this would be more about the individual. And chapter 13 talked more about the environment, uh, adaptation for massage around the breast area, and what are the special concerns, pregnancy, pediatrics, geriatrics, more awareness of gender diversity, acute care, chronic illness, oncology, hospital long-term care, and hospice patients. We talked about these a little bit in conjunction with the medical facility adaptations. Individuals with physical impairment or a psychological diagnosis. This goes back to our terminology and people first terminology as well. These people might have this, but that doesn't mean that that is why they are there for massage. So we need to always see the people first and treat the individuals as a unique person, just like anybody else. And there we go. So my job as I outline this chapter for you is to focus in on, obviously, content that would be tested on the MBLEX, but that's relatively minor when we put this into perspective on how we teach a broad spectrum of a client base. And then again, like I had said, how you could narrow each of these areas down into a specialization if you want to. You're going to have your broadest sweep for a retention-based practice if you work with multiple groups of people with multiple situations and know how to adapt in multiple ways. And the intention is to provide massage related to our 4 evidence-informed outcomes and adapting the methods that we talked about in chapters 10 and 11 and the assessments around that, in addition to any type of adaptation that might be needed for this category of client care. So here are the objectives, key terms. Pay attention to these. You are likely to encounter these terms in a question structure on the NBLEX exam. So critical thinking and effective decision making is absolutely necessary here. There is no recipe. There is no prescribed protocol. Our foundation that we have established up until this point is relevant here. When you take additional training or classes, what they would show as far as method is concerned is the adaptation, sideline position, for example, or shifts and changes in depth of pressure, or more important, more discussion about general information related to this common collection of things that people are involved with, like athletics, or are managing in their life, like a physical disability. All right. So there is no recipe for any of this because each individual is different. So here's your reminder about how you're going to need to use critical thinking and how you frame your decision and how you then implement. All right. Animal massage. So here's the deal. They've got hair. They can't speak English or any other language. They can speak dog, or they can speak cat, or they can speak horse. So we have to kind of interpret through a non-verbal communication. And veterinary care and massage, there is some overlap there. And in some states, it's not licensed at all, but in others, the massage needs to, especially if it is in conjunction with some sort of a treatment for a condition, would be under the supervision of a veterinarian. So the important thing is that massage is more than petting. So that's mindful. There's a purpose, and there's an outcome. So, and that outcome can be relaxation and well-being, but there is a level of professionalism and application, and you can teach clients how to massage. On the YouTube channel, Luke has got a sequence of how he has works with some hip dysplasia issues with Raven, his German Shepherd. So you can take a look at that if you want to see an example. Assessment is unique, just like it is with people. Here's some dog anatomy and some horse anatomy. Now you can superimpose that in how human anatomy is compared. That's called comparative anatomy. Most of the companion animals and working animals we would be involved with are quadrupeds, or on four feet. So that would be 4 legs. That would be a little bit of a different understanding. So if you are going to work with animals, you need to understand the animal. So two suggestions I could give you is that would teach you how to be with the animal would be grooming, learning to be a groomer, because they have to learn how to interact with the animal, or a trainer. So, obedience training, that sort of thing. With a horse, there's grooming, there's a farrier, there are also trainers. And that could be another place where you can get information about the animal, and then you can modify how you would work with that animal. Obviously, a standard size horse is much bigger than a cat, right? And cats have a different temperament than a dog. And so these are things that we have to consider. That's what we're talking about here. And then there are veterinary tech textbooks that you might want to access, and that can also give you some idea of how you would interface with these companion and working animals. Proficiency exercise is about giving you some experience with others that work with animals. So like I said, the communication is very similar to infants and young children. Your communication will also be with the adult companion, the human companion. And here are some guidelines on what not to do. If you're going to work with animals, don't do these things. All right. So there's me in a photo shoot trying to work with a very unhappy kitty, actually, who scratched me. And then a very cooperative dog who loved being the demo. All right, so here are some benefits for animals. And teaching somebody to massage their companion animal or working animal is just as healthy and calming for them as it is for the animal. So happened to my Luke, his spouse is involved with, she's involved specifically and extensively with leader dog or service animals. It's amazing the commitment that these animals have to helping us, and the behavior modification that is necessary there, and how stressful it can be. So here are some types of companions that can benefit from massage. Here are some of the conditions that massage could be helpful with. And here's that, we're talking about that human benefit here. So pain management is important here as well. You need to be able to recognize pain behaviors and what medications are being used. There's a huge overlap between human medicine and veterinary medicine, but there also are differences. And then, kind of how you might provide massage, how you might adapt here. So you want to take a history and perform an assessment. And then you have your same qualities of touch as we had before. And my cat, Smokey, is currently marking the computer as her territory. So if you see a jiggle, that's what's going on. And then special considerations for horses. They're a large animal and you need to know how to be around them. All right, always slow down with your key points. These are like mini summaries. All right, now, athletes. So we talked about the athletic environment. This is specific for the person. There is additional guidelines about fitness in the next chapter. So the distinction needs to be made between professional athletes or competing athletes, as well as amateurs who are also competing, maybe not for money, maybe it's not a job. People who are involved in an athletic or a fitness activity, such as cardiac rehab, and then general health. Exercise and fitness is necessary for sustaining general health and well-being. So here we get into the massage adaptation around those issues. And we've already talked significantly about tissue damage, and this goes in. So this acts as repetition, repetition, repetition as well. We talk about a load and that a force is a push or pull. So this should feel very familiar now as you're reading this. And then, how that is common in athletic or musculoskeletal type issues. Some medications that are commonly used, and then common sport injuries, skin injuries, terminology to know. This would fit in with some of your pathology as well. And remember, there's a pathology appendix A at the end of the book. Then we have muscle injuries, and anybody can have these: acute muscle soreness or delayed onset muscle soreness, stiffening. So this information works for multitudes of populations. It's just more common in an athletic population. So carefully pay attention to this. And always, head trauma, again, could show up in a car accident. It doesn't have to be specific to an athletic fall, for example, or, helmets are common. So you've got helmets for riding bikes, for example, or playing football. But there still is concussion potential here. This is concussions are always serious. They should always be evaluated. A strain is within the muscle structure filament along with the associated fascia. And so there's going to be an interaction between the agonist and antagonist. They will sometimes be a co-contraction to guard or stabilize that area. And it's important that the torn ends are not pulled apart like with stretching, even though that's what people might want to do. That guarding, that initial response, that co-contraction is to pull those ends together and keep them close together. And that needs to kind of be there through the subacute healing phase. So this gives you some ways to determine whether you can go ahead and work, because in the acute phase, this would be a local contraindication. So you can use these general assessments here to determine how significant the injury is. So, if a person is walking, they are confident in doing some of the balance assessments, like standing on one foot, then it's even though it might be tender, it's probably a grade 1. Grade 2, you're going to see hesitancy around all of that. And certainly grade 3, they're not going to be able to weight bear on it. They're going to protect it. It's going to shorten, might be cramping. Okay, so tendon injuries would be more of the sprain. I take that back. Erase. A tendon injury is still a strain type injury. It's still associated with the muscle structure, but it's going to occur closer to the joint. And it's common to have a sprain and a tendinous strain. So that's something that you need to be aware of. You sort of kind of treat them the same. So, but because of the blood flow into a tendon as opposed to a ligament, they may heal better than the ligament structure. And we have the inflammation of muscle tissue, and tendonitis and tenosynoviitis, and these are commonly tested. You're going to find this term on the MBLEX exam, so you're going to want to know what it means. And tendinosis. So itises mean inflammation. So itis. So this is the sheath around the tendon. But this, when it starts to be an osis, you're starting to get fibrotic changes, more significant connective tissue changes. It starts to get a little brittle. There can be instability and ligament laxity around all of that as well. And then we have synovial joint injuries. So here's the first, second, and third degree sprain. This is more ligament related around the joint capsule. And then here's your grade 1, grade 2, grade 3. You'll want to know this. So joints, because of the movement involved with the joint moving in the closed pack and open pack position, and the use of the shoulder, knees, ankles as part of the performance, these are the areas that sprains and joint injuries can most commonly occur. Dislocations, again, can happen to anybody, but they do occur potentially more frequently in the athletic population, mostly related to falls or an impact. Again, you're going to want to have a working knowledge of this. You're going to want to recognize what this is, and likely may find. Remember, on the MBLEX, we are trying to give you an ocean's worth of information so that you can address any question that a bucket might pull from that. So you may never find a question about this on the licensing exam, or you might find 3 or 4. I just don't know. But in general, this type of information is important for you to know, especially with any kind of orthopedic interface or networking for a client. Dislocations do create laxity and hypermobility, so you want to be aware of that. Joint stability and supporting mobility is an ongoing issue. So then we have wear and tear injuries, and traumatic arthrosis is common with reoccurring joint injuries. Bursitis is a friction, a rubbing injury, and again, the repetitive movement can be a precursor to this. Bone injuries, acute bone fractures, stress fractures, again, anybody can have these. So along with the nerve injuries, this is good stuff to know just in general. Postural changes, heat illness. This would be your hyperthermia or your hypothermia. This is important. Elderly and the young are also very susceptible here. So that is a foundational bit of knowledge that's important for everybody to have. And, you know, you want to have general recall in the real world when you're working with a client. This would either you would be told this is what's going on, any of these injuries in here, not just the heat related. You'd be told what's going on, or you would suspect it based on what the client's telling you, and then you can go and look up more. So the recall starts to become how to ask an intelligent question so that you can find more information and then interpret it. Okay, so here's your ongoing care of the athlete. And you'll use everything, all your methods, all your approaches, all your adaptations. And then here are your key points. The biggest mistake people make with competing athletes is that they think that they are robust and healthy, and that is not necessarily the case. They are actually relatively fragile, and the peak performance interferes with the stress response, or it triggers the stress response. The short duration of recovery starts to use energy reserves. Sleep is disturbed. They're really kind of fragile. And while they might want a lot of aggressive massage and boom and all that, you've got to be the correct professional that is able to help them make better choices based on what their actual physical status is. Okay, breast massage. So the big issue here is the ethics of it, and the unfortunate interface with sexuality, erogenous zones, and so forth. So that is the concern. And in general massage, you don't massage the area. It isn't worth it. Ethically, it is not worth it. Doesn't mean there isn't value, but it is, the risk is not worth the benefit for you or for the client. As far as breast exams and all of that for cancer, that should be something that they are doing with another health professional, not you. Now, if there has been a surgical intervention in the breast area, then we have to stop and consider still the ethics and the conceptions and misconceptions that can happen around the area. But we can also be involved with some scar tissue management. So breast augmentation, breast reduction, breast cancer, gender reassignment surgery, and so forth. We would be looking at tissue pliability, supportive healing, etc. So that's the issue here. And this is what we're talking about here. And here's your massage adaptation and scar tissue, etc. And then this picture shows you how you can address the anterior chest by moving the breast tissue over or using a sideline position where the breast tissue drops away. We don't want to ignore this very important upper thorax region, especially with the need to address appropriate breathing function. This is where that happens. So I don't think it's prudent to leave the area out, but you also have to consider the uniquenesses here. And this is one of the areas where I recommend that a male massage therapist would possibly refer a female client to a female therapist. That doesn't mean anything about gender identity or where our relationship interests are at or anything. This is to protect the male massage therapist from inappropriate touch allegations. So we're using this as an example of how we would use ethical principles as part of our critical thinking decision here. Okay. And then regardless of gender, this is important. You need to have specific written informed consent for working around and on breast tissue if it is even indicated. Work with another professional in the room. Use very careful draping. Work professionally and confidently and avoid the nipple area. I worked with a lot of breast reconstruction related to secondary cancer care, and the stuff the procedures they're using now is way better than it was back in the day. So that's really exciting. But it was all around scar tissue management and tissue pliability and fluid movement. All right. Here's another area that there's a lot of misconception around and a lot of myths. So slow down and read this and don't believe those myths. Massage therapy at all stages in a normal pregnancy is just fine. So here's information specifically about pregnancy. Here is in very big letters that stimulation of certain acupressure points or reflexology points during pregnancy may induce labor. This is not true. And then if you're going to work with people that have this as part of their current experience, and you need to understand the normal and be aware of the abnormal adaptations that the body makes during pregnancy. So here's your first trimester and how you would adapt. This box is accurate information about massage therapy and pregnancy. Here's your second trimester and what happens and what you need to be cautious about and how you would how you would adapt. And then into the third trimester. So this gives you enough, positioning is important, sideline position, but you should be using sideline with everybody, not just somebody who is pregnant. So just, this is a caution. These are just cautions that require adaptation. And then we have awarenesses of where the pregnancy is moving away from a typical normal pregnancy. And then that would require us to refer. refer. And these are those situations. And then here are the recommendations. So the one thing to be aware of is that pregnancy is considered a hypercoagulability state, meaning that the blood clots a little bit more readily than normal. So that is so when the placenta pulls away from the uterus, there is no hemorrhaging. But that clotting affects it systemically. So you need to be a little bit more aware of a deep vein thrombosis development, usually in the lower legs. And these areas produce swelling, redness, or pain, and it hurts when they walk, and the area looks a little angry, especially as the clot is interfering with circulation in the area. So just be more cautious. That's all, and aware. So here's some pictures on positioning. Makes it kind of fun. And there are some videos that accompany this chapter on the Evolve site as well. Okay, so here's some fun little proficiency exercises. Here's what happens with labor and delivery. And then where I think massage can really help is in the postpartum period. Certainly it helps during the pregnancy, but during the postpartum period, I don't think in our society we do a very good job with that. So, if you wanted to look at an area of interest here, I would suggest you at the very least, include the importance of the postpartum period. And then here are your key points. And then we move into pediatrics. The big thing here is consent. You don't work with a minor, and unless the parent gives consent and is present. Typically, for an infant massage, you're going to be an educator. You're going to teach people, the parents, the caregivers, how to do a basic massage with the infant. It can really help people with their confidence in touching that infant. Pressure delivery, rhythmic pressure delivery is also a good stress reliever for everybody, including kids. And our kids are stressed. So, the first thing that happens when I sit down next to one of my grandsons is they stick their feet in my lap. That kind of touch and rhythm and reliability and all of that, that's important. You're not probably going to have a lot of kids that are paying clients, right? This would be something that really does lend itself more to teaching the parent. So here are some general information about infants and childhood and adolescent development, and some fun little pictures here. And this goes into the toddler and the preschooler, what is the development like there, and then into the adolescent years. So, slow down, read this, pay attention. And then here are your adaptations. And the biggest one is potentially overclothing, and your timing, your maybe not as long, and as an educator, and consent. Those are the big areas there. Massage has a lot to offer older adults, geriatrics. Remember, we talked about ageism terms in our communications. And so, we want to be respectful. And so here's your general overview and a nice little sequence of pictures here. Now, pay attention to your pictures, read your legends. And then just like with understanding pregnancy, you need to understand the aging process. So here is some overview information on that. Medication use is common, so you're going to want to pay attention and know what the medications are that people are taking. Medline Plus, again, is an excellent source for looking up medication and understanding. And your client should know what the medications are supposed to be doing to help their body. It is not uncommon for there to be some cognitive changes. There is some pretty good research that shows that massage can temporarily, there comes Gary, the animal, temporarily help with some of this neurochemical interface and might help with some of these symptoms, at least in the short term. Older people aren't touched, and so massage can provide that physical, non-sexual, social interaction. We also deal with gender, and our society is working on biases around gender diversity. And we need to ask, what terms should I use? Teach me, help me. What pronouns? Help me understand this. This is not a judgment, but help me understand. And if you have a bias about this that you cannot get over, then this is an indication for a referral. It is unethical for you to work with a person, regardless of the situation. If you're judgmental and biased from somebody over somebody who has a lot of body art, then you can't get beyond that to give a compassionate massage. Then you need to refer that individual to somebody that does. So here's some information about the languaging around gender diversity, and some information about gender transition and gender affirmation, and this re-education about gender roles, terms like genderqueer, agender, bigender, and non-binary. Then we also have intersex. This is these are individuals that are born with both sexual characteristics. It can be a hormonal, genetic thing. It's about 5% of the population of people that have this, and it used to be that this situation was surgically altered, almost always surgically altered to female. And the individuals that as adults are trying to understand this internal conflict between their biological gender and the display of that gender and the hormones that they might have been given. We need to have grace and understanding and appreciation of this and not judgment. So hormone therapy and some surgeries are usually part of gender affirming care. If we're going to work with this population, we need to have a little bit more understanding of how all that works. And this is how, here are recommendations on how we would support gender congruency and how that person reconciles this and our respect for that. And here are your key points. Acute care we've talked about, and this acts like a review and how we would adapt around that. Acute illness. Illness is a body-wide thing. Injury is local. We need to know about wound healing. And then here's this box. This is repeated. This showed up in other places. Here's some application here for wounds, scars, sprains, and strains, and gives you guidance on how to work through that and how to deal with old and problematic scars, which we did discuss when we were looking at connective tissue targeted approaches. And then here's your adaptation suggestions. And specifically, this is a really good box, strategies for pain management. And then it talks specifically about acute pain management and the use of medication. Chronic illness is where massage therapy really can be helpful in managing symptoms and supporting quality of life. A factor of a chronic condition is discomfort, pain, and we can interface in that area. And then here are suggestions as typical about how we might adapt to these long-term debilitating conditions. And the short-term symptomatic relief that is really important for these types of conditions. The goal is not to fix. The goal is to support and help and increase the quality of life. We also have to be aware that there are a lot of medications involved here. Some control in autoimmune conditions is to control inflammation, pain medications, there can be hormonal support, there can be blood pressure medications, cardiovascular medications can fall into these chronic conditions. So what we want to do is help that person the very best they can with hardiness and resilience. And body, mind, behavior modification, relaxation techniques, the person's spiritual journey, all of these are part of an integrative approach to helping individuals with chronic conditions. If your mindset is that you're going to fix it, you're going to be frustrated. So look at these goals and expectations here. And the client has to also have realistic expectations, and they need to understand that it's about doing better, not getting a cure. So then their expectations are more realistic, and they understand the importance of needing to have massage on a regular basis, not sporadically. Adaptation to oncology, you need to understand the treatment process, how it changes the body. There are some specific courses that are available that help you absorb that information. You can also, do a self-study on this and so that you understand more about what cancer pathology is, how does it affect the body based on where it is located, what the treatments are, chemical, radiation, intravenous, prescription medication. They're making huge advances here. Cancer is often now treated as a chronic condition. So, but each of those interventions, those medical interventions, they have side effects. And so massage can be part of during active treatment, helping the person cope better with those side effects, as well as during in a remission period, and those remission periods can be long-term, some of the remaining side effects that have occurred, neuropathy being common, or uh, fluid movement issues related to some surgical intervention, or scar tissue maintenance and making sure that it remains pliable. So multidisciplinary care is important. Tissues, we need to pay attention to our pressure and drag, dependent upon how the tissues have responded to treatment. And very simplistically, cancer treatment is to remove the aberrant collection of cells and then to kill the rest of them using a controlled, almost like a poisoning, to target fast dividing cells, because that's what cancer cells do. They're undifferentiated and they divide and they don't know what they want to be, and they infiltrate, they get, they attack, and that's why cancer pain is acute pain. It's breaking down normal tissue, just like an injury would. And so the other fast dividing structures, or those that actually are damaged by the cancer treatment and don't regenerate well, are affected. So skin, mucous membranes are often compromised, hair loss. These are all fast dividing tissues. So they're going to be affected by the treatments. And then common is nerve damage, neuropathy, the chemotherapy, the various drugs, the immune treatment attacks the myelin around the nerves, and so the nerves can become compromised. So a massage can help with that. It can't cure it, it can help. So here's a little about surgery, radiation, chemotherapy, and side effects. And again, there's been a lot of research on how massage can be supportive while a person is going through these kinds of treatments. Palliative care and hospice care are different. And palliative care is common in conjunction with cancer care, cancer treatment, and then post-cancer treatment. But you got to understand that it's not the same as hospice. So make sure that you've got your terminology correct. Hospice care is end of life care and comfort care. Palliative care is as well, but it also is about improving quality of life, and it can also mitigate some of the side effects that somebody might have. And then here are general recommendations for massage adaptation, and then some cautions and suggestions. Pay attention to these if you're going to work with somebody that is in this situation. Okay, and here's this fatigue, cognitive issues. There can be some personality shift. It's an all-encompassing situation when you are kind of looking at life and death right there, and family members are involved too, and it gets the social dynamics. So this is truly a biopsychosocial interface, and it does best when there's a multi/interdisciplinary support team, not just during the active part, but post-cancer care as well. So we get into long-term care and hospice patients, and so um, there is some increase in massage therapists actually working in a hospital setting. Cancer care is sometimes offered as a support during pregnancy care or pregnancy massage. The key is here in a hospital type setting, you're not going to see people for very long, 1, 2, possibly 3 sessions. In long-term care, that's different. Palliative care is different. Hospice could be a series of interactions, but in the hospital, it's usually not. So your palliative approach is your main focus. So this talks about the benefits of massage in hospice care, more about palliative care. And then this is a mentoring tip. This is a personal experience here. I did have open heart surgery for a blockage and had a triple bypass. And this is Luke. Look at how young and how he was working with a palliative approach for comfort care. So we also talk here about adapting to a hospital room as well as the environment. Fortunately, you're not trying to apply pressure, so your body mechanics are not in place so that you are having to apply maximal pressure, because you're not going to have a massage table in the area. So you might find yourself with a little bit more of a reach, or the height might not be ideal. However, the pressure levels are not deep either, and the duration is much slower, or you don't massage as long. Your timing might be 10, 15 minutes. So this talks to you about how the massage therapist would adapt, and the caution needed around all the medical devices. Make sure that you only use the lubricant lotion provided by the hospital. Don't bring anything in. So here are your responsibilities to the patient. The person would be called a patient in that environment. And then your adaptation to long-term care. This is becoming an interesting area here. The population is aging now. Not everybody in long-term care is older. Anybody that needs ongoing physical and mental support could be in long-term care. But the majority of people are aging. And how we are going to do that, and how we're going to care for people as I'm in my 70s, we are less able to do everything to care for ourselves. How are we going to do that and maintain the integrity for the individual? And who's going to do that? It's if we're the major population growth area, then who is going to be part of that? So I think we're going to start to see more assisted living facilities that have categories of care. And I think that massage therapy will be a very important part of this. This has yet to develop, but I could see these large retirement communities, these large long-term care communities having a wellness center with massage being part of that. But if you're going to work with an older population, you have to understand aging. So we talked about that back in the previous chapter. And then here is the hospice end of life care. And my biggest suggestion here is if you feel drawn to work with this population, and I hope some do, that you will take their volunteer training, and that you will certainly be committed to that environment. So a lot of times in hospice, you're going to be providing massage in the home, and you're going to have to adapt to that home environment and some of the equipment that's in the area. Just respect, ask, and have a conversation. So I heard that hospice nurses and staff are midwives to the dying, just like we have birthing midwives. So there's end of life care doula, which is a support person, just like there is a pregnancy and postpartum doula. So this is a very rewarding, but you have to deal with your own connection, which you need to have. You need to connect, but you need to do that in a professional way, and you're going to grieve, and that's okay. Some people have an increased tolerance to how much of that they can be exposed to and attend to their own well-being. That's for any of these. These special categories of population, they put a little bit of an additional emotional and professional strain on the massage therapist, and we have to watch our own. We have to monitor our own wellness and how we are able to respond, and when we've had enough and when we need a break. All right. The proficiency exercise here is pretty challenging, and I strongly encourage you to do these 4 things. So here are the key points. And then we're going to get into physical impairment. And this is about adaptation again. And we do need to challenge ourselves with subtle discrimination and implicit bias. And we need to be attentive to our environment so that people that use assistive devices can get in and out of our environment, including the restrooms. So this gives you some overview and some language here. And we, again, need to be aware of our own inexperience in a certain area, how we would gain it, if it's too much for us to adapt to and maintain our own well-being. These are all questions that are involved in this area. So here is a critical thinking activity for you here that is going to help you, use the template, the critical thinking template, to pre-think your way through, to, in a way, rehearse your way through how you would respond in these types of situations. And then a proficiency exercise here as well. So we've got low vision or blind, and refer back to people first terminology and ask people to help you help them. What do I need to do? If they use a service animal like a leader dog, then how do you need to interface with that animal? The best is to ignore the animal. That animal, if it's in harness, is working, leave it alone. If a service animal is got a little smock on, that animal is working, leave it alone. They're trained to go lay down. So that's a little bit of suggestion you can give there. Don't change your environment if vision is an issue. People learn the environment. Even with my low vision, I know my environment. I move much freer with more confidence in an environment I am familiar with. But if somebody's moving things around all the time, that doesn't work very good. So this, this gives you a little bit of guidance on how to guide, how to give suggestions. Just and don't move anything, just leave stuff where it is. The person knows where it is. Okay. With a speech impairment, then you need to make sure that you have a communication that will work. And if there's a hearing loss that is part of that, that's not a speech impairment. But if it interferes with communication, you can write. My goodness, with English as a second language, I've got students. I've had students as English as a second language, and the translation programs and the technology and the artificial intelligence that's available to support communication is so helpful. So similar suggestions here for people who are deaf and with hearing loss. Mobility, and that has to do with the ability to navigate from one area to the other, and individuals use a lot of assisted devices. It can be a walker, it can be braces, it can be crutches, it can be wheelchair, it can be bracing. There's a lot of new technology that's actually allowing people to be lifted up in a wearable robot that moves them around. There's some exciting things happening in this area. We just need to know how to work around it and what assistance is needed for a transfer. And I'm always intrigued. And if you're truly intrigued and want to learn more, to be more supportive and more respectful, not condescending, most people, most of the time, are more than happy to help you learn more. Traumatic brain injury, nobody has it the same. So it could be from a concussion, it could be from a cerebral, a stroke, it could be from a bad infection. There's, it can be a percussion, see that if somebody has been in an explosion. And it's never the same. Not everybody manifests it the same. So we have to learn individually about each of our clients. And the guidelines here are just a scaffold about how you would ask the questions. Massage is great. It helps people in their managing and coping in their daily activities when they have to use their body in a different way. You can also have cognitive changes here as well, and you need to understand what that is. And we have size considerations, tall, short, for whatever reason. Do we need to have a stool? I've worked with basketball players. They're tall. We've had to come up with some unique strategies to extend the length of the table. So I've worked with very large people, and they didn't fit comfortably on the massage table. So I adapted to working with them on the floor so that they could sprawl out. But there can be difficulty in getting up and down off of the floor. So you have to stop and think around all of this. Sometimes the bolsters are too small and they need to be bigger, and or they need to be smaller. Some people are very thin. They don't have a lot of soft tissue surrounding their bones, and we have to adapt around that. Sometimes we have to put additional padding on them. I've massaged, you put a pillow on top of somebody who was very thin and applied compression through that. It was much more comfortable for them because I wasn't, their bones weren't poking up through my pressure. People who are obese, uh, is, you know, they're larger, mobility is involved. There's a lot of judgment here. Don't do that. Uh, and um, you don't need to talk to somebody about nutrition and weight loss. They already know. They already know it all. We right now have more inner action and a treatment with a new class or a different class of weight loss or weight management medication. So that may need to be considered. Um, the fat, superficial fascia stores fat. So that layer might be thicker. And the sensitivity there could be some fluid accumulation. So it may be difficult to apply enough pressure to get through that superficial layer to actually get to where you can feel the deeper muscle structure. That's okay. Don't worry about it. Don't poke. Make sure that your contact area is broad. Uh, Sometimes the lymphatic adaptation, especially if fluid accumulation is part of the tissue changes. If somebody has lost a lot of weight, there might be excess skin that needs to be translated away from where you want to apply your pressure. Communication is everything. And embarrassment doesn't help. So if you can't get over your ability to see the person first in these types of situations, any of these situations, then you need to refer them to somebody that can. And it's nice to have peer support and mentoring, uh, so that you can go and ask somebody, well, how did you work with these particular situations? Burns and disfigurement are common. Um, my generation was taught not to look, to try to ignore. That's not going to happen. Our body, we're not going to do that. We need to acknowledge that we're going to be drawn to differences, and that we then need, as the professional and as a human being, we need to move beyond that and work with the individual and connect with the individual. Various types of scar tissue approaches can help a healed burn. And in the latter stages of burn healing, there can be itching, and massage can help with that. And burns, depending on the degree of the burn, can compromise down, that can burn through the protective areas, And there can be changes in fluid distribution, and scar tissue replacement's very stiff. They're actually doing a much better job these days in treating burns than back in the day when I worked with some clients that had extensive second and third degree burns, and had a lot of grafts, and how that, how they would contract and all of that. Where medical treatment is doing better. Massage is a great comfort care, not to treat the burn, but to provide maybe massage of the hands and feet if they're not involved, or the feet, or whatever area is not involved. Pleasurable sensation in that area may be beneficial, maybe not. Uh, you're just going to have to, it's a trial and error, it's an educated guess. Infection is a huge issue with burns before they are in the remodeling phase. Disfigurements are disfigurements. We don't all look the same. All right. Here is our psychological diagnosis, and these are not visible. And so sometimes people are not understood because there is something of an appearance of different. Somebody hasn't had an amputation or lost a limb. Somebody has not got a scar, or they don't, they're not in a chair, in an assistive device. So we don't always understand the challenges presented by these types of situations. So here's a list here. Massage can help, but we have to understand, we have to get an idea of what, if it's a chemical addiction, what the withdrawal responses are, and how massage can help with, addictive cravings. And there's research that shows that we can. A variety of chemical imbalances that affect mood. People that have a different way of interfacing in the world. And I think our society is much more forgiving, thank goodness, about cognitive and differences and intellectual changes. And that can happen with dementia. It doesn't have to be a condition somebody is born with. It can happen with a closed head injury. We are much more forgiving about the richness of neurodiversity. And then there are diagnosable psychiatric disorders, schizophrenia, bipolar, the psychotic disorders. They can be treated by medication and behavior modification somewhat. That's stressful. Massage can help, but we need to understand how a person might interpret or respond to changes in their environment. And the same with post-traumatic stress disorder. And we already had some discussion about trauma-informed care. So one of the things that we have here, if there is some sort of a cognitive change, and of course, if somebody is affected by a chemical imbalance or an addictive process, along with these others, we may not be certain that they have been able to give consent. So that is something that we have to be aware of. And then we need to understand the neurochemical interface and the process of addiction if we're going to work with this population. We need to understand the medications that are involved, both to treat and that may be abused. Same with this intellectual diversity. It maybe if we can get to the place where we see this is a difference as opposed to a disability. The thing is don't talk to somebody like they're a child. You communicate with an adult at their level of understanding and not below their functioning levels either. They're not kids. Same with older adults. You know, you need to learn how to communicate the very best you can when there might be a delay in the ability to process that communication. The idea of cognitive differences, and you can have cognitive changes due to a brain injury or a chemical imbalance. I had a cognitive change after the heart surgery. I had some problems with memory. I have continue to have some aphasia, and you know, I have certain cognitive challenges that frustrate me, and when I am tired, I manage them less effectively, and it just understanding. People don't always disclose, so you have a hard time understanding too. So if somebody isn't going to necessarily disclose, at least in your own processing of the interaction, that it is likely that they were doing the very best they can at that particular time. You, me, we don't have to take it personally. Um, we are much more aware of the various spectrums of and probably just uh, brain processing uh, diversity as opposed to a disability. The challenges come when individuals have to function in a world that doesn't fit the way their being wants to process it. And then they have to adapt and adapt and adapt and adapt. So I heard the term being used, masking. So you know, I got to pretend, I got to act like I fit in the world, even though I don't. Not their world, but I can. But think of the energy it takes to do that. And I have dyslexia. I fit in this category. Um, and some of it is, oh well. I still have to spell correctly. Technology has helped. I still have to be aware of, you know, when I'm giving directions that I'm going to possibly get things confused. I also have a visual issue, and I think I'm starting to lose some hearing in an ear, and I'm older, you know. Wow, what a mix, you know. And sometimes we have to have a sense of humor about it all as well. ADD, ADHD, lots of research happening around this, and the overlapping neurodiverse uh, disorders that are together. Sometimes they, you know, it takes a while to sort out what treatments and what behaviors and you know what how we need to be um, aware of when somebody needs to just go and be able to reconstitute their own internal self-management. Uh, Autism spectrum falls into this, and it's a spectrum. It's big. You know, nobody does it the same way. Tourette's is a tic disorder, often shows up in the rest of these situations. And it can be a verbal, there can be vocalizations that go with that. Uh, Then we have our learning differences, and I mentioned I have dyslexia, and my handwriting is terrible. Um, and then we can have a variety of degenerative conditions. This chronic traumatic encephalopathy, CTE. I dealt with that with cumulative trauma with football players. So that's another thing to consider, are these degenerative changes. Mild cognitive impairment, I'm sure I have some of that going. And all sorts of uh, neurocognitive disorders, not just Alzheimer's. And the individuals that are managing these conditions absolutely can get a headache, or they can sprain their ankle, or they can have tension in their shoulders. We just need to understand how to interact resourcefully. So psychiatric disorders, the concern here is that somebody might have an exaggerated response, and we need to be prepared to act appropriately, including reaching out for assistance. So we've got anxiety, panic, and depression. Pain and fatigue syndromes overlap tremendously with anxiety and depressive disorders. Uh, we are there's also now a recognition that laxity syndromes, connective tissue dysfunction is common in this area, as well as in the neurocognitive arena. Breathing disorders is something that we may be able to interact with in this situation that will be very beneficial. Eating disorders are also common, and they can be life-threatening, just like depression is life-threatening, and we need to be aware of that. People with these conditions are seeing us on a regular basis, then we become part of the surveillance of paying attention when the person is not able to self-regulate, and they could be in danger. And we need to make sure that we have contact information, emergency contact information. And if you are concerned, if your gut is telling you something is significantly wrong, then you have 911, and the EMTs, the first responders, know how to deal with this and make sure everybody is safe. So, and then post-traumatic trauma and post-traumatic stress disorders. We've all experienced some trauma. Our body's response, as I've said before, is how we have survived it. But we don't come out of it the same. I don't care what it is. And we've learned to adapt. We've learned different level of vigilance. And that's not necessarily a bad thing, but if these adaptations become invasive and interfere with quality of life, then it's helpful to have an intervention, a multidisciplinary intervention that can help a person. So here are the various types of trauma, and some information on fight, flight, freeze in through here. An awareness of abuse. It can be physical, it could be emotional. We're a global society. People can be coming in that have experienced torture. There's childhood abuse, elder abuse. A lot goes on here. Part of the adaptive response, the survival responses, is how do we get through the next 15 minutes and then the next 15 minutes and the next 15 minutes? And when do we know that we don't have to survive another 15 minutes here? And that's where some state dependent memory, and we can get intrusive thoughts and dissociative behavior that can come into play here. So this content is important, and you're going to want to process through this and do some self-reflection. These intrusive experiences can be quite distressing. We kind of have all experienced a brain that won't shut down, where we keep going over and over a certain situation, a problem we're trying to solve. But this is much more involved than that. And there could be even a flashback where a person is feeling as if they're back in that situation again. And there may be some triggering events or triggering sounds or triggering smells. And occasionally, the massage application can trigger. And all you do is hold the space and let the person find a center of balance again. And if they can't within a reasonable amount of time, then that's when you would get to your emergency support people and call them. And if their emergency contacts people are not available, we have our first responders that we can rely with, but that's very rare. If somebody's breathing shifts or changes, just allow it to happen. Don't engage. Just they're doing what they need to do. It takes special training. Don't perpetuate the trigger. Don't try to get the person to tell you what's going on. Learn to be still and allow. That's how you interact with this. So that's sort of kind of what we were talking about there and what to do with emotional responses. And then a little bit more on trauma-informed care here for you. Gives you the whole biology of trauma, gives you a better understanding of what's going on, especially with that hyper-aroused, hyper-vigilant state that people can't get out of. And then the principles of trauma-informed care. And then where you can go and learn more. So, what you don't want to do ever is perpetuate any kind of re-traumatization. You don't want the person to reenact. That is not healing. And in the past, people thought that they had to relive it. And this would be these cathartic, sometimes they used a word, somato-emotional release, that those are not helpful. So how well the person is coping with this depends on the nature of their multidisciplinary support. So we absolutely can be part of this. But there is a little bit of an additional awareness, not the massage, but there is a little bit of additional awareness on how we respect the space of the client we're working with. So there you go. So here it is. Respect is important in any interaction with another person and with an animal. In all situations, remember to see and address the client first, then accommodate to the specific needs by offering assistance and following directions provided by the client. There is no formula. There are a few guidance things about what not to do. And it's always helpful to work with a health support team so that you are not isolated, um, working with individuals that have some complex concerns. Don't isolate yourself. Okay. And then we get to our referencing and our questions at the end of the text. So whenever I discuss this, and you're going to hear about this information more and more, I know people want an answer. I know people want, well, do this and don't do that. And I just can't do that. I can provide some guidance and I can create some awareness, but we're different and how we do things is different. And so, you know, a few, dealing with somebody that has some physical impairment and needs barrier free, that's easy. But the others are not so easy. And you've got to give your own self grace when you're looking to work with others that have factors that may make how they perform in the world, a little bit more challenging, or they have to expend more energy to accomplish the same kind of thing. So compassion and grace and empathy, and but don't compromise yourself either. So, okay.